Understanding insulin, the body's blood sugar regulator. Insulin is a small but mighty hormone that plays a central role in the body's metabolism, especially in regulating blood sugar levels. Produced by the pancreas, insulin ensures that the energy from the food you eat is stored and used effectively. Without proper insulin function, your body's systems can go haywire, leading to serious conditions like diabetes, heart disease, and metabolic syndrome. Despite its importance, insulin is often misunderstood, frequently discussed only in the context of diabetes. However, its influence reaches far beyond blood sugar, impacting fat storage, protein synthesis, brain function, and more. This article explores what insulin is, how it works, what happens when it malfunctions, and how you can support healthy insulin function naturally. What is insulin? Insulin is a hormone produced by the beta cells of the pancreas. Its primary job is to regulate blood glucose levels by helping glucose enter the cells of your body, where it can be used for energy or stored for later use. When you eat carbohydrates, they are broken down into glucose in the bloodstream. This triggers the pancreas to release insulin. Insulin acts like a key, unlocking the doors of your cells so glucose can enter. Without insulin, glucose remains in the bloodstream, leading to high blood sugar levels, hyperglycemia. Functions of insulin. While most people associate insulin with blood sugar, it has several other crucial roles. Glucose uptake and storage. Promotes the uptake of glucose into muscle, liver, and fat cells. Encourages storage as glycogen, in liver, muscles, or fat, in adipose tissue. Regulation of fat metabolism. Inhibits the breakdown of fat, lipolysis. Encourages fat storage when excess energy is present. Protein synthesis. Stimulates amino acid uptake and promotes muscle building. Inhibition of ketogenesis. Prevents the production of ketone bodies when glucose is available. Overall metabolic balance. Helps balance the storage and use of carbohydrates, fats, and proteins. Types of insulin issues. 1. Insulin resistance. This occurs when the body's cells become less responsive to insulin. As a result, the pancreas produces more insulin to compensate. Over time, this can lead to chronically high insulin and blood sugar levels. Symptoms of insulin resistance may include fatigue, weight gain, especially around the abdomen, sugar cravings, difficulty losing weight, increased hunger, skin tags or dark patches of skin, acanthosis nigricans. Insulin resistance is a precursor to type 2 diabetes, metabolic syndrome, and cardiovascular disease. 2. Type 1 diabetes. An autoimmune condition where the body's immune system destroys insulin-producing beta cells in the pancreas. People with type 1 diabetes require lifelong insulin therapy. 3. Type 2 diabetes. Occurs when the body becomes resistant to insulin or doesn't produce enough to maintain normal glucose levels. Often linked to lifestyle factors such as obesity, inactivity, and poor diet. 4. Hyperinsulinemia. Chronically high levels of insulin, often as a response to insulin resistance. Over time, this can lead to fatigue, fat gain, and increased risk of chronic disease. What causes insulin imbalance? Several lifestyle and genetic factors can impact insulin function, including poor diet, high in sugar and refined carbs, sedentary lifestyle, chronic stress, obesity, lack of sleep, hormonal imbalances, genetic predisposition. How to improve insulin sensitivity naturally. The good news is that insulin resistance and high insulin levels can often be reversed or improved through lifestyle changes. 1. Eat a balanced, low glycemic diet. Focus on whole foods that cause a slow rise in blood sugar. Choose complex carbs, vegetables, legumes, whole grains. Include fiber, slows glucose absorption and improves insulin response. Emphasize healthy fats, avocado, olive oil, nuts, seeds. Eat lean proteins, fish, poultry, legumes, tofu. Limit or avoid added sugars, soda, white bread, and processed snacks. 2. Exercise regularly. Physical activity increases insulin sensitivity, especially in muscle cells. Aerobic exercise, walking, jogging, cycling. Resistance training, weightlifting, bodyweight exercises. Aim for 150 plus minutes of activity per week. 3. Maintain a healthy weight. Losing even 5 to 10% of your body weight can significantly improve insulin sensitivity and reduce risk of diabetes. 4. Get enough sleep. Poor sleep raises cortisol and disrupts insulin regulation. Aim for 7 to 9 hours of quality sleep per night. 5. Manage stress. Chronic stress raises cortisol, which increases blood sugar and insulin demand. Try meditation, deep breathing, yoga, journaling, time in nature. 6. Consider intermittent fasting. Intermittent fasting can improve insulin sensitivity and reduce insulin levels by giving your body time to rest and reset between meals. Medications and insulin therapy. When lifestyle changes aren't enough, medications may be prescribed to manage insulin-related issues. Metformin improves insulin sensitivity. GLP-1 receptor agonists promote insulin secretion and satiety. Insulin therapy for type 1 diabetes or advanced type 2 diabetes. Always consult with a healthcare professional before starting or changing any medication. Insulin in special populations. 1. Women with PCOS, polycystic ovary syndrome. Many women with PCOS have insulin resistance, which contributes to symptoms like irregular periods, acne, and infertility. Managing insulin can significantly improve symptoms. 2. Older adults. Aging can reduce insulin sensitivity. Regular exercise and good nutrition become even more critical in maintaining metabolic health. 3. Athletes. Insulin plays a role in recovery and muscle growth. Athletes may use carbohydrate timing to optimize insulin's effects for muscle repair and glycogen storage. Conclusion. Insulin, a key to health and longevity. Insulin is far more than just a diabetes hormone. It's a master regulator of metabolism, energy storage, and cellular function. When in balance, insulin helps you feel energized, maintain a healthy weight, and protect against chronic disease. When out of balance, it can lead to a cascade of metabolic issues. By adopting healthy habits, like regular exercise, clean eating, adequate sleep, and stress management, you can help your body use insulin efficiently and maintain long-term health.